CMS Division of Tribal Affairs. I would like to welcome everyone to an All Tribes webinar. My name is Nicole Pino and I work for Kaufman and Associates. I'll be your moderator today. Today's webinar is titled Medicaid and CHIP Eligibility and Enrollment Final Rule. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. And at this time, I will turn it over to Beverly Lofton.
Thank you, Nicole. Thank you so much. Good afternoon, everyone. Good afternoon. I'm Beverly Lofton. I'm a Senior Policy Advisor at the CMS Division of Tribal Affairs, and welcome to today's webinar. This webinar is in collaboration with the Division of Tribal Affairs and the CMS Children and Adults Health Programs Group. During this webinar, the presenter will give a high-level overview of Medicaid and CHIP eligibility and enrollment processes and share key highlights of a newly released regulation. That regulation is entitled Streamlining Medicaid, CHIP, and Basic Health Program Application, Eligibility Determination, Enrollment, and Renewal Processes. Any materials related to this presentation can be downloaded from the Spotlight page of the CMS American Indian and Alaska Native Outreach and Education website at go.cms.gov/AIAN. The web link will be added to the chat in this webinar. So now I am pleased to be joined on this webinar by Senior Policy Advisor Stephanie Bell, and she again is from the CMS Children and Adults Health Programs Group. So I will now turn it over to Stephanie to begin the presentation.
Thank you, Beverly. Let me know if there are any issues with hearing me today. But I am so excited to be here with you all. As Beverly said, I'm Stephanie Bell. I'm a Senior Policy Advisor, and I have been at CMS for almost 14 years now, working on Medicaid eligibility and enrollment. And I am very excited to get to talk about this final rule that we published in the Federal Register on June 3rd. So this is really the culmination of years of working with states and hearing from stakeholders and the public about what we could be doing to make eligibility and enrollment more effective and efficient, and to make sure that eligible people can get in the door and that they can then stay in the door once they've been determined eligible, provided that they continue to meet eligibility requirements. We published the proposed rule in September of 2022, and we ended up finalizing it in two parts. The first part was published in September of 2023, and that focused on provisions that were aimed at increasing enrollment and retention in the Medicare savings programs. That's Medicaid eligibility for people who are dually eligible for Medicare and Medicaid. So the Medicare savings programs pay for premiums and cost sharing for Medicare coverage. Today, I'm here to talk about part two, which is the second half of the rule. And as Beverly said, the full name is quite a mouthful, so I'm not going to try to say it again here. But this rule includes Medicaid, CHIP, and the Basic Health Program. Sorry, the Children's Health Insurance Program and the Basic Health Program. I'm going to focus on Medicaid today, but wanted you to know that there is more than Medicaid in here, and that the slides will be available, as Beverly mentioned, so you can download them and you'll be able to take a look at all the other information. Now, before we jump into streamlining eligibility and enrollment processes, I wanted to take a few minutes to do some level setting and talk about, make sure we're all on the same page about what eligibility and enrollment is. And when I came to CMS in 2010, I thought I had a pretty good understanding of basic Medicaid eligibility. And I found that 14 years later, I am still learning new things almost every single day. There is just a lot to Medicaid eligibility, and there's so many options, and every state has its own program. And so with all the flexibilities, there are just millions of ways of doing things. So I thought we would start off with just a little bit of a very brief history of the program, because I think understanding how it evolved will make some of the changes that we're going to talk about today make a bit more sense. And I'm kind of a history nerd too, so I think it's really interesting to know that the program really originated in 1965 as health insurance coverage for AFDC recipients. So that was the old Aid to Families with Dependent Children program, basically cash assistance for children and pregnant individuals. And so that was 1965. In 1972, the Supplemental Security Income Program was established, or SSI, and that was designed to provide cash assistance to people who have blindness or disability, or who are over 65 and have little or no income or resources. And Medicaid again was expanded to provide coverage to individuals receiving SSI. So we essentially had two buckets, those eligible for AFDC and those eligible for SSI, and they were entitled to Medicaid based on their receipt of benefits in those other two programs. Slowly over time, eligibility has expanded and grown, and mandatory coverage became available not just to children and pregnant individuals and parents getting AFDC, but to higher income, somewhat higher income folks. And then states were given the option to expand coverage to other populations. So they started to add in groups like people with disabilities who were working, people who have breast or cervical cancer, people who were receiving long-term services and supports, home and community-based services essentially, and who would be eligible if they were living in a medical institution. So there were all these new flexibilities that we've offered to states. And then the Affordable Care Act came along and extended eligibility specifically to people who were under 65 and had income below 133% of the poverty level, as well as kids aging out of foster care. And as the program has grown, today we have more than 50 different eligibility groups. So it's helpful to understand sort of some of these basics. And to enroll in Medicaid, then, a person must be eligible for an eligibility group covered by their state. So they have to meet the specific requirements for that group, along with some very broad general Medicaid eligibility requirements that are, the two big ones are residency. You have to generally be living in the state in which you're enrolling. And then you have to be a US citizen or have a satisfactory immigration status. Now, when you look at specifically who is eligible in a group, each group covers one or more categorical populations. So I mentioned some of those populations: pregnant individuals, kids, SSI recipients, children in foster care, people with disabilities. So there are lots of different categorical populations. And so you have to meet that requirement to be in a group. And then there are generally financial requirements that go along with it. So before, originally when the program was tied to receipt of SSI or AFDC, Medicaid didn't really have to do its own eligibility determination. But today, most of our eligibility groups have income and some have resource requirements as well. And that's where the history becomes helpful, because for eligibility groups based on having blindness, disability, or being over age 65, states continue to use basically the SSI methodology to determine them financially eligible. So, when they're looking at what types of income are counted toward eligibility, or how you decide who's in the household and whose income counts, states will turn to the SSI methodology. However, for groups that started in that other bucket, children and pregnant individuals and parents, for a long time, states were continuing to use the AFDC methodology. And that was even after the program ended and transitioned into what's now known as TANF, or Temporary Assistance to Needy Families, I think it stands for. And that continued to be the case until the Affordable Care Act changed the requirements and said, states, we want you to start using modified adjusted gross income. And so we want to align eligibility for Medicaid and the Children's Health Insurance Program and the Basic Health Program and coverage available through the health insurance marketplaces. And to do that, we're going to have you use a person's modified adjusted gross income. So basically their tax income, taxable income, to determine eligibility. But we're going to carve out all of these groups that traditionally relied on the SSI methodology and exempt them. So where that leaves us today is we typically talk about MAGI-based eligibility groups, modified adjusted gross income, so the children and families groups, and MAGI accepted or non-MAGI groups, and those are the groups related to age, blindness, or disability that continue to use the SSI methodologies. So that was a whirlwind Medicaid eligibility 101. So as we started thinking, okay, we have an opportunity to do a new eligibility rule. What kinds of things do we need to focus on? What's going to be the most impactful? And our directive really came from these two executive orders on strengthening Medicaid and the Affordable Care Act, and continuing to strengthen access to affordable quality health coverage. So the Affordable Care Act, in addition to setting up the use of MAGI or modified adjusted gross income and creating some new eligibility pathways, it also contained a number of things that really helped to streamline eligibility and enrollment. So use of an online application, primary reliance on electronic verification. So before you can make someone submit a paper document to demonstrate that their income is in fact what they've attested to, checking those available electronic data sources, as well as permitting greater use of self-attestation. So, when a person applies and says they're a resident in the state has the option to either go verify that residency or just accept their attestation. And there were some great simplifications established by the Affordable Care Act, but they were really focused on those MAGI-based populations. So the populations that, were coming into this new process that was going to streamline access to coverage through Medicaid CHIP and the marketplaces using this new MAGI-based methodology, and kind of left to the side those folks who were in the eligibility groups based on being over 65 or having blindness or a disability. So we really wanted to make sure that we were making these simplifications and these access improvements available to everyone. We also, at the same time, were thinking about the integrity of the program. And for instance, we know that insufficient lack of documentation to demonstrate that a person is eligible has been a big cause of program-related errors, that when an auditor goes to look at the program and they don't find enough documentation to substantiate the determination made, it's flagged as an error. And so part of the problem with that, we realized as we were looking at our rules, is how terribly outdated our record-keeping requirements are. So that was definitely on our minds. And then in between all of this, we had the public health emergency and states beginning to do unwinding, which I'm sure you're all pretty familiar with, as they've been going through renewals for all of their population who had been covered throughout the public health emergency, and working very closely with CMS to make sure that their processes were functioning correctly. And, so they had both this unprecedented number of renewals to do, along with very, detailed look at how they were doing them. So we've been doing a lot of work in that area as well. So our goal really was about finding the right balance. So in terms of this rule, looking at all the simplifications that are available and that have been found to be effective with the MAGI-based population, as well as thinking about how can we demonstrate the integrity of these processes and how they not only help eligible individuals enroll, but ensure that ineligible folks get transitioned to the right types of coverage for which they are eligible. So it's kind of a matter of finding the right balance. We received a huge number of public comments on the rule, and most of the comments were very supportive of the rule as a whole and a lot of the specific provisions within it. And we did also receive a number of individual comments raising concerns and flags about particular issues within the rule. And so we spent a lot of time thinking through those, and I think really made some improvements in the final rule stage in response to those comments. One of the biggest areas of concern was timelines, because again, as states are working on, are continuing to work through unwinding or kind of recovering from unwinding, you might say, there's a lot going on. And so the idea of adding a bunch of new eligibility and enrollment changes on top of all that, it was a lot. So one of the things that we looked at was which of these changes really supplements or assists the work states are currently doing, and which of them build upon it. And we set up a phased-in compliance time frame. So some of the things that are effective immediately are changes, mostly options that we wanted to make available and provide access to as soon as possible. And then things that were going to require a lot more systems changes are phased in over a 3-year period. Getting to the meat of what did we do in this rule? We've had a whole history lesson. We've talked about kind of what our thinking was. So now, what actually is in the rule? Well, we've divided it up here into 4 key objectives. So starting off with getting people through the door, then once they're in, making sure that eligible people can remain enrolled. The third provision is around access barriers that primarily are applying only in the Children's Health Insurance Program and really are kind of outdated and don't make a lot of sense based on the way the program has evolved. And then the fourth provision is, as I mentioned, ensuring the integrity of the program. So I'm not going to go through all the slides, but we have a slide touching on each provision in the rule to kind of just give you an overview of what the provision is and briefly what changed. And all of this will be available for you to download, but I'm really going to just focus in on a few of the provisions. There we go. Okay. So the first chunk of changes are around the application and enrollment process. And I am going to touch on aligning non-MAGI with MAGI application requirements, establishing standards when individuals need to provide additional information at application. And then I'm going to skip down to the almost last one, remove requirement to apply for other benefits. So now you're all remembering, I'm sure, the difference between MAGI and non-MAGI and how the MAGI-based applicants had, for example, one of the simplifications was that in-person interviews were no longer going to be permitted. In many cases, Medicaid agencies required, it's for most states been quite a while ago, but people to come in for an interview before they could be enrolled. And that requirement was removed for MAGI-based applicants, and this rule extends that to all applicants, as well as some of the simplifications around being able to apply online, by phone, through the mail, and in person, and then being able to submit additional information through all of those modalities as well. And then when eligibility can't be determined based on available information, one of the things that I'm excited about in this rule is we establish, excuse me, some parameters for submitting additional information. So we understand that in many states, so I should take a step back and say, first off, there is a required time frame currently and prior to this rule for completing an eligibility determination. So if an individual is applying on any basis except for disability, states are required to complete the determination within 45 days. You know, the idea being get the person through the door as quickly as possible so they can get access to the coverage that they need. The states have a bit more time, 90 days, if they need to do a disability determination. And so if you're thinking about just this 45-day timeline, well, today with online applications and electronic verifications, a huge number of applications are able to be processed the same day. And if you go up a day or two, it becomes an even bigger chunk of applications. But there are a lot of cases where a person maybe they missed a field as they were completing the application, or the information they provided isn't quite lining up with the information that the state is finding when they try to verify, for example, their income. And so they need to get additional information. So there has not been any kind of minimum amount of time that states must provide to a person. So in this rule, we established that states must provide a reasonable period of at least 15 calendar days for a person to provide more information. So it's still not a huge chunk of time, but it does provide it, at least 2 weeks, including time for mailing if needed. And then if they don't submit the additional information needed during that time, and the state does determine, okay, well, we can't find you eligible because we don't have enough information, and so they deny their application. If a person then follows up within, which here is described as the 90 calendar day reconsideration period, then the state will reopen their application and they won't have to resubmit. So in many cases prior to this, if the person didn't get back to the state in time, they would be denied and they would have to fill out a whole new application. So under this rule, they will be able to just reopen the application and start it moving forward again. So I mentioned that there are certain requirements that apply across all Medicaid eligibility groups. And one of them was or currently is still, the requirement to apply for other benefits. And this, we think it was related to old rules that were applicable under the AFDC program, where, the idea being if a person was eligible for unemployment assistance or retirement or a pension, that income should be counted towards their eligibility. But we know today that a lot of those types of income are actually not even countable, and that there are eligibility groups that don't have any income or resource requirements. And so conditioning someone's eligibility on them applying for other benefits just doesn't make sense anymore. So in this rule, we eliminate that requirement. We still encourage states to help people apply for other benefits for which they may be eligible. The idea definitely wasn't to try to prevent them people from getting access to other services or other benefits, but really to stop the conditioning of their Medicaid eligibility on the receipt of those benefits. So removing an unnecessary barrier to help streamline enrollment. So the next section we're going to touch on is related to, okay, now we've gotten a person enrolled in Medicaid. What are the processes and for keeping them enrolled and for moving them to other coverage when they become ineligible? Thank you. We've got 4 provisions in here. I'm actually going to spend a bit of time on 3 of them. Okay, this is another area where we had made some changes following the Affordable Care Act that were really, states had the option to apply them to all of their beneficiaries, but they were really only required for those whose eligibility was based on MAGI. And those were that eligibility must be renewed once every 12 months and no more frequently than every 12 months. So some states previously did 6-month renewals. I'm not sure if there were any more frequent than that, but there was no prohibition. So now for all but one eligibility group, which is one of those Medicare Savings Program groups, states must renew once every 12 months and no more often than that. And then at renewal, the Affordable Care Act, as we were implementing those provisions, we required for MAGI-based beneficiaries that they receive, if the state was unable to renew their eligibility based on available information, that they send them a form that was pre-populated with all the information available, so they didn't have to go looking for things that the state already had. So pre-populated form, and then we required that they provide at least 30 days for the person to return the information. And then, like I mentioned at application, we also established a reconsideration period. So all of these requirements through this final rule will now apply to all beneficiaries, both Magi and non-Magi. So there are a few differences, but we were really trying to align the application requirements. Couldn't give quite as long a time to respond at application since we were limited by that 45-day timeliness standard for determining eligibility. At renewal, the state can start the process earlier so we can provide, or they can provide the individual with more time to respond. So the individuals have at least 30 calendar days to provide information. And then, like I mentioned before, if the state needs, so the process would work such that a state would go and check electronic data sources to see if they could determine that the person was still eligible. And if they were unable to, based on that information, pre-populate a renewal form, send it to the individual, and then give them 30 days at least to respond. If the person didn't respond, maybe they didn't see the renewal notice, maybe it got stuck under their pile of mail, maybe, many things could have happened. They didn't return it on time. And so the state was unable to renew their eligibility. If within 90 calendar days, the person does subsequently return the information, then the state would need to reopen their case and re-enroll them as if they had submitted a new application. So all those processes now are going to be available to all beneficiaries, both Magi and non-Magi. So we've talked about what happens when renewal comes. So all beneficiaries' eligibility has to be renewed every 12 months. And then at the same time, individuals must submit information when they experience a change that could impact their eligibility. So loss of a job, new job, increased income, maybe they got a raise. So that information states are required to collect from beneficiaries in between regular renewals. But the regulations were silent on the expectations for processing. So we took the protections for beneficiaries that applied at renewal, and through this regulation, we're applying them to the changes in circumstances. So if either a person submits information indicating that they've experienced a change in income, or the state checks electronic data sources on a regular basis and sees a change, or maybe the family applies for SNAP benefits and that information is shared then with the Medicaid agency. So they've determined that a change may have occurred. The state is required to reach out to the beneficiary and determine, ask them for more information. And similar to renewal, they must give them now at least 30 calendar days to respond with additional information. If they don't respond and the state is unable to determine they continue to be eligible, so they send them a notice of termination, the person will again have that 90 calendar day reconsideration period where they can, oh no, I missed this piece of mail asking for additional information. They can send it back into the state, and the state will need to act on that as if they've submitted a new application and redetermine their eligibility. We've also added a change here that prohibits procedural terminations when verifying eligibility for additional benefits. So we understood that in some cases, a state would receive information indicating a change that would be positive for the beneficiary. So maybe they were moving from a group with more limited benefits to a group with extra benefits, and they are permitted to send a request to the individual to confirm that the information is correct. And if they didn't hear from them, some states were disenrolling the individual because they thought, well, they must have either moved or, they're no longer interested in the coverage. So through this rule, we're prohibiting those kinds of terminations. This is really another type of change in circumstances, and we've learned a lot about updates to beneficiary addresses, particularly during the unwinding period. So we established some specific requirements in regulation for steps that states must take to find beneficiaries when they've moved and to update their addresses when they receive information about a change. So two things that we're requiring in this final rule are states must set up a process to act on specific types of changes. So when they receive returned mail from the US Postal Service that has a forwarding address, they must act on that. And they must set up processes with their managed care plans to obtain information on address changes. People, I'm sure you wouldn't be surprised, tend to notify their plan before they notify the Medicaid agency that they have a change of address. So being able to use that information and automatically update beneficiary addresses, we believe will make a big difference in keeping people updated of changes. So if they do need to submit a renewal form, or the state does learn about a change in circumstances and need more information, that they'll have the right address to reach the person. So there are some proactive steps that states must take to update beneficiary addresses. And then they also must take steps to try to locate beneficiaries if they do receive returned mail that doesn't have a forwarding address. So if they can't find the person before they disenroll them, they have to take action through at least two modalities. So ideally, sending the person an email if they have an email address, sending a text message, making a phone call, trying to track the person down before they terminate their eligibility because they can't find them anymore. Objective 3 is really mostly specific to CHIP. So the first 3 provisions are around eliminating CHIP-specific things that can prevent a person from having access to coverage. So locking them out for failure to pay premiums, requiring a period of waiting before they can enroll, and then establishing benefit limits. These are all things that are not permitted in Medicaid and really aren't permitted in the marketplace either. And so they were very specific to CHIP. And through this rule, we are removing those requirements and also establishing a new optional Medicaid eligibility group that will allow states, another one of those I think will be at 51 now, that will permit states to offer Medicaid eligibility to specific groups of children with disabilities. So the last 2 provisions in this rule, the first one is about timeframes for redetermination at eligibility at renewal and based on changes in circumstances. And then the last one is about strengthening our record-keeping requirements. So I wanted to spend just a few minutes on the timeframes for redetermination at renewal. There is a lot going on here, I recognize. The idea here is that we wanted to make sure both that beneficiaries had adequate time to submit information to the state when they needed it in order to complete a determination. We also wanted to make sure on the flip side that the state had adequate time to complete a determination when they needed more information. So under the current rules, until this goes into effect, I think in just a few days, actually, on June 3rd, there is a timeline for processing applications, which I mentioned at the beginning, and I've said so much that you've probably already forgotten that. So states are required to process new applications within 45 days for most beneficiaries and within 90 days if a disability determination is needed. But once you get someone through the door, there are not similar timeframes in regulation for completing a renewal or acting on a change. And so we in this rule not only set up those specific requirements that states must provide people with at least 30 days to respond, but we also establish timeframes for completing a renewal. You can see here, first we've got the application column with the 90 calendar days and 45 days to complete a timely determination. Then if you've got a reported change in circumstances, so individual submits information indicating that they have a change, or the state obtains information from another data source, the state would then have 30 days. They would have until the end of the month that occurs 30 days after the report. So if we obtain information today on 5/29, we would have until the end of June to process a redetermination based on that change, unless we needed additional information from the individual, in which case then an additional 30 days would be provided. So state receives information, checks in, it looks like, oh, that might impact the person's eligibility. They send them a notice requesting additional information, give them 30 days to respond, and then by the end of the calendar of the month that occurs 60 days after that initial determination, they would need to have completed a redetermination. At renewal, states would be expected to complete a renewal by the end of the eligibility period. So if my eligibility was ending on May 31st, the state would have until that time to complete my renewal, unless they needed additional information and I did not submit it timely. So kind of again goes back to that. If they check data sources, find that, oh, we can't tell that Stephanie Bell continues to be eligible, we need some more information, they send me a pre-populated renewal form, I would then have 30 days to return it, but say I didn't get it back in time. So we're getting towards the end of my eligibility period. Here we are at May 29th, and I submit that additional information. Well, it's too late for them to act on it and complete my renewal by May 31st. So this rule will give them until the end of the month following if the information is submitted with less than 30 days left in the renewal period. So really what we were hoping for here, or our intent with these provisions, was to make sure that individuals had enough time to gather any needed information and submit it to the state so that you could really get eligible people through the door. And if they were already enrolled and remaining eligible, it's much more beneficial for both the state and the beneficiary to keep them enrolled, if they can get all of the needed information, than to have to disenroll and go through a whole new application and a new eligibility determination. So trying to find again that balance to make sure that there's enough time available on both sides for both the individual and the state. And the last slide is really just about our record keeping requirements, and really trying to make sure and work with states to document all of this information. As we have moved from a more paper-based system, with actual file folders with written applications in it, to a more electronic system where a person may apply online, all their verifications may occur electronically, and maybe they even receive electronic notices. Those things are all going to show up in the system very differently than that old-fashioned paper file. So wanting to make sure that we're working with states to collect all the needed information so that at any time a reviewer could go back and determine that, yes, that case was done properly, or if a person was disenrolled and appealed that change, that the state would have proper documentation and clear information explaining their decision-making process. So that was a lot of information. I think we're going to move into questions now. hoping that you all are not too overloaded.
Thank you, Stephanie. Yes, so this is our time for questions. We'll first be addressing the questions already submitted in the Q&A box. So we did have a question. So this record keeping change is negatively impacting Oklahoma. We tribes have been able to store documentation, and that was accepted. That provision is now being taken away, apparently due to this change.
So it would be very helpful to understand better what types of documentation have become challenged or have been challenged under these new requirements. It would help us to both better see whether they are things that must be provided to demonstrate eligibility, or really things that the state needs to maintain documentation of in their records for record keeping purposes. If you're able to provide any additional feedback, that would be helpful.
Yeah, and Yvonne, you can unmute yourself to help clarify.
Can you hear me?
Yes, we can.
Hi, Stephanie. Thank you very much for your presentation today. And you've just brought up the piece that we've been getting updates from the Oklahoma Medicaid agency on attestations and documents that historically we've saved on site. So maybe it was proving residency. It could have been a birth certificate. It could have been a tribal card that we had in patients' records. And that was something that we were able to keep, and the Medicaid agency accepted that, because basically they don't have staff on the ground. They have community partners, tribes, public health that do their eligibility for them. And so we're just in the last 30 days being made aware that that will no longer be an acceptable practice, and we can't see the verifications. And so it's coming very fast as far as what's being rolled out to us. And so it feels like something that we've been successfully doing for years is being taken away, and could in some instances impede eligibility timelines.
And so so tell me if I'm understanding correctly. When working with a specific individual, are you talking about the types of documentation that you're able to provide related to that person's eligibility?
Yes. So like
Okay.
Historically, when citizenship had to be documented, one of the ways we can do that is with a birth certificate or with a tribal card and prove it. And that's something that we didn't have to upload. We could, but it's never been required. We could keep that on record, and that we were the repository of the documentation.
I see. Okay, so it's specific to the individual, but now the state is looking for you to upload something so that they can, in their records, maintain that documentation as well.
It's not exactly sure. It's just saying that we won't be storing that information anymore. So I think with you saying this is becoming effective on June 3rd, that I now understand why we're seeing a flurry of information coming to us and changes in processes. And we weren't understanding what was happening. And this, you've provided insight right now.
Oh, good. Okay.
And I'm not sure that I understand the intent, but ultimately it could be a negative for how states and partners have worked together.
I had just a quick question, Yvonne. Hi.
Hi.
So are you referring to attestation? So we previously you were able to hold on to those documents without having to verify, but now you have to actually upload them to verify? Is
We're
that
looking
what
for the rest? Beverly, we're looking for the rest of the guidance. What they're just saying is we will no longer store the documentation. So if we're no longer storing the documentation and being responsible for that, then when I'm going to assume they're wanting us to upload it, or how the process is changing. And we're basically getting this information within the last 2 weeks and change and what will impact how things have been done.
Thank you.
So it's an enlightening for me to understand what's going on at this point, because there's been no explanation that it was coming into compliance with a CMS guideline.
So coming back then to us, I thank you for helping us understand coming back to the record keeping requirements for a moment. So the way we set up the rule is that it becomes effective 60 days after publication. So that's going to be June 3rd. And then, but compliance won't be required with all of it'll be required on a rolling basis. So for example, with the record keeping requirements, states are going to be required to transition to entirely electronic records. So maintaining everything in an electronic format. We haven't provided a whole lot of detail on that. And yes, and while it does become effective on June 3rd, we won't be requiring compliance for until 24 months after. So there'll be a 2-year period of phase-in. So it sounds like in your state, they are getting moving on that, and you are flagging for us a challenge that is creating and may create, I guess, depending on how they end up fleshing out the details, which is really helpful for us to be thinking about as we work on additional guidance.
Correct. And again, it's an understanding, but we're just seeing changes coming down without explanation. So thankful for this All Tribes webinar to provide this additional enlightenment, and we can work through it. But before, it's just kind of like, what is happening? Because I raised some things yesterday about feeling like we're seeing some additional barriers being implemented. And this just felt like an additional takeaway. Now I can at least understand the rationale for why they're trying to do it. And we can work toward it, because there just was no explanation to what we were seeing in communications coming to us on such a quick turnaround. Because it's like we've been told come June 1st, we will no longer see this information, and it won't be accepted. So with no explanation.
Well, I'm hopeful that we can continue working with you all as we as the guidance continues to evolve and get into more details. And Beverly will hopefully have an opportunity to come back and if we do have more information, or folks do have questions beyond today, since there was a ton of information here, is there a good process that you and I can?
Yes, Stephanie, I would reach out with Beverly and Kitty to continue dialogue on this. Again, I thank you very much. I'm not meaning to be critical. You answered a question.
Your input is really helpful.
Thank you. Call this morning, and everybody's going, "Why is this being taken away? We don't understand." And now you've enlightened me as why Medicaid is taking, why our agency is taking the steps. But it would just be good if we had dialogue for explanation, and you've helped at least trigger what's causing the change.
Okay.
Yeah, and just always, as new regulations or new rules become final with effective dates, as Stephanie mentioned, there is a 2-year phase-in for this. So of course, CMS will be looking at how states are phasing it out, and looking at if there needs to be additional guidance put out on helping states phase it out the correct way, so there's not unintended consequences.
I did get another comment in the Q&A box. So another point for Oklahoma specifically is that this ability has taken away immediately. However, CMS is saying that there's a 2-year phase in. Appears this could have been handled much differently by our OHCA. So
one of the things that we really did try to do in the final rule, kind of going back to state concerns about the implementation timeframes, was to create flexibility as much as possible in terms of how to answer, by when things needed to be implemented, giving as many options as possible, such that if a state already had a process in place that really achieved the same goal, trying to make it possible to continue the process already in place. So we tried to give as much flexibility as possible, but I can see that certainly can make implementation more frustrating in some cases.
So what about a 16-year-old in a household being questioned and asked to verify that they are not employed?
That is a good question. We are currently working on a suite of guidance that really goes into a lot more detail about renewal requirements and how to effectuate the electronic checking of information to determine whether someone remains eligible. Kind of details about what to do when there are multiple people in the household, what to do when there are multiple income types, when there are data sources available for some types but not other types of income. So we are working right now on guidance. So keep an eye out. It should be coming out. We have a whole suite of guidance planned for the next 6 months or so to go into a lot more detail on particularly verifications and use of electronic information, and when to ask for, when to send a renewal form, how to pre-populate a renewal form, all those kinds of things. So hopefully that the answer is coming.
Great, thank you. So there are no more questions at this time, and I would like to send it over to Beverly Lofton for closing remarks.
Awesome. Thank you so much, Nicole. Thank you so much, Stephanie, for joining us today and giving that great presentation as always. So we really do appreciate it. I want to also remind you that you can submit any inquiries to the CMS Division of Tribal Affairs mailbox. And let me give you that mailbox. That mailbox is at tribalaffairs@cms.hhs.gov. Again, that is tribalaffairs@cms.hhs.gov. And then again, the presentation will be downloaded. We will have that presentation available, and that's going to be at go.cms.gov/AIAN, and you'll be able to find that on the CMS American Indian and Alaska Native Outreach and Education website. We will also have a copy of the recording available. And just a reminder that the effective date for the processes mentioned today is going to be June 3rd with a 2-year phase-in period for states. All right, with that said, hopefully everyone has a great afternoon. Bye-bye.